I've already washed my hands. My name is Riley. I'll be your nurse today doing your assessment. It'll take approximately 10 minutes, and if you have any questions throughout, just let me know. And I can assure you that all this information will remain confidential. Okay? Miss Brimhall, can you tell me your name and date of birth for me?
Darla Brimhall, 6/20/1973,
Okay, and why are you here today?
for a health assessment.
Okay, patient is alert and oriented ×3. She is dressed appropriately for the assessment. Her mood and affect is also appropriate, and so are her facial expressions. I'm going to check your memory by telling you 4 words and then have you repeat them frequently throughout the exam. The 4 words are dog, pen, ocean, and house. Okay?
Dog, pen, ocean, and house.
Yes, ma'am. And now moving on to vital signs. I checked them before. Her heart rate was 74 beats per minute. Blood pressure was 124/78. Respirations rate was 14 breaths per minute. And temperature was 98.7. All of these vital signs are appropriate and within normal limits. So, Ms. Brimhall, do you have any pain today?
I do not.
Okay. Moving on to her skin assessment, I will check her skin trigger in her hand, which is non-tinting. Her skin is dry, but not too dry. Skin color is appropriate and consistent throughout her whole body. Ms. Brimhall, do you have any tattoos?
No, ma'am, I do not.
Okay. She has no lesions on the legs, no edema. She has some scars, but nothing serious. So moving on to her head, which is normocephalic. Her eyes are on the upper third part of her face. Her nose is midline, and then mouth is on the lower third. She has no facial drooping, which would be checking cranial nerve number 7, which is the facial nerve. And then to check cranial number 5, which is the trigeminal nerve, I'll have you close your eyes, and then I'm going to touch the side of your face, and you repeat to where I'm touching. Okay?
Nose, chin, cheek or jaw, forehead.
Okay? And now clench your teeth together. Okay, it is strong bilaterally. So now I will check her scalp for any parasites, any lesions, anything that could be serious. Okay, she has no parasites, no lesions. Her hair is not dry, it's not oily, it's well cleaned. So now moving on to her nails, I will check for cap refill, which is less than 3 seconds. She has no clubbing on her nail beds, which means her nails are less than 160 degrees. So I'm going to check her feet as well. Her cap refill is also less than 3 seconds. And no clubbing in the toes, which also means, again, the nail beds are less than 160 degrees. Moving on to her eyes, I will be checking optic or cranial nerves 2, 3, 4, and 6, which are the optic nerve, the oculomotor nerve, the trochlear nerve, and the abducted nerve. So first I'll be checking to make sure her eyes are reactive to light. So her pupils are equal, round, and reactive to light. There was no drainage in her eyes. Her eyes are symmetrical on her face. And now I'm going to be moving on to her ears. Do you have any pain in your ears anytime?
No, ma'am.
Both ears are clean, no drainage, nothing coming out that's serious. So on her ears, we check cranial nerve 8, which is the auditory nerve. So I'm going to have you close or hold one ear, and then I'm going to stand on the other side and whisper a word and have you repeat it to me. Okay? So I'm going to start on this side.
Baseball.
I'm going to this one.
Apple.
Okay, there we go. And can you repeat those 4 words I said earlier?
Dog, pen, house, ocean.
There we go. Moving on to the nose, I'm going to check for patency and make sure nothing's occluding the nose. Okay, there is no drainage, nothing occluding. And to check this cranial nerve 1, which is the olfactory nerve, I'm going to have you hold a nose or one side of your nostril and then breathe through the other side. And then go. Yep. Perfect. Moving on to the mouth, I'll be checking her mucous membranes. They are pink, moist, no swelling. All teeth are intact. Can you say ah? Uvula is midline. Her tonsils are still intact. And stick your tongue out. There we go. And I'm checking in the mouth cranial nerves 9, 10, and 12, which are the glossopharyngeal nerve, the vagus nerve, and the hypoglossal nerve. Moving on to the next part of the assessment, I'll be checking her carotid pulse, one side at a time. And is strong on the left side, as well as the right. She has no lesions, no swelling in the neck. Her skin color is consistent as throughout the rest of her body. So I will auscultate her carotid. Strong and equal bilaterally. Also, can you turn your neck side to side? Looks like she has full range of motion in her neck as well, which in this assessment we check cranial nerve 11, which is the spinal accessory nerve. Moving on to the lungs, I will check 6 places in the front and 10 in the back to check for clear lung sounds. Okay, everything is clear bilaterally on the front. Moving to the back, and I'll need you to take deep breaths for me. Big deep breaths. One last one. There we go. Everything sounds clear bilaterally on the back as well. Moving on to the front, or to the breast exam, I will not perform, but I will teach Ms. Brimhall the appropriate way to do it throughout the year. So there's 3 main things you want to look for: skin color changes in the breast, any asymmetrical on each breast, and when you palpate any tenderness or masses. And also you want to look for discharge. So you'll do the breast exam in 3 different positions: laying down with your arm up, standing up with your arm up, and then you also want to look in the mirror to see if there's any physical changes that you can't tell by looking down at your breast. Okay? If you have any questions, just let me know or let the doctor know, and thank you for your time.
Okay, thank you.
Oh, I can't find my cursor.